Welcome to the Community Resource, the official podcast of the My City, My Health Conference. Join us as we shine a spotlight on the incredible vendors, organizations, and service providers who are making a real difference in our community's health and well-being. In each episode, our host, Paula Bell, will sit down with conference vendors to explore the vital services and resources they offer. From healthcare to mental health support to nutrition and social services and beyond. Now, whether you're looking for help, you want to connect with local resources, or you simply want to learn more about what's available in your community, this podcast is your guide.
Hey, my brothers.
How we doing? How y'all
doing?
Hey, what's going on? Fantastic.
I love that.
Fabulous.
I know.
Couldn't be better.
It's been an interesting day, right? It's been an interesting day. Though it's a rainy one. I wish it wasn't raining as much today, but, you know, it is what it is.
Hey, it is what it is.
It is.
We'll take this last little bit of...
excited. Yeah. Last little bit of what, Larry?
I was going to say, we're just kicking out our last little bit of spring before that rain turns into something else that we really don't like.
Yeah. Mm-hmm.
That snow.
Yeah. That needs to hold off until after the conference, though, because we don't need all that.
Right.
Talk about it.
We don't need none of that.
Right.
It just needs to hold off. I can still continue with the weather we're having now until we get to the conference time. So y'all excited about the conference? I'm excited about the conference.
Man, who would have thought year 4?
Right?
That would be in year 4 of, My City, My Health, this idea that we had, just kind of like, hey, what about this? What if we do this? Not knowing what we're doing, but hey, we made something beautiful out of it. So it's been it still doesn't feel like, man. I think I texted Larry this maybe a month or so ago. I'm like, we're really going on year 4 of My City, My Health. Like, this is crazy to think. But here we are.
So crazy. And you know what? Honestly, I still have this thought sometimes that I can't believe that we took a topic such as health equity and turned it into a party, a meetup, fellowship. So I'm just really proud that, not only are we getting this information out and, informing our community on, what's going on, resources available and stuff like that. But also we're able to do it in a palatable and fun and engaging way. So, we got to remind ourselves, Core, and even you, Paula, because you're a part of the My City, My Health family now, right? Like, we just got to pat ourselves on the back sometimes and just know we're doing that important work out there. So, yeah, cheers to year 4, definitely.
So that means year 5 is going to be off the chain.
It's got to be.
It's going to be off the chain.
It has to be.
Oh, I need to be part of that. I'm telling y'all that right now. I need to be part of that somewhere, somehow. So, what's so amazing about this, though, is that I knew both of you all before My City, My Health. Mm-hmm. And it's so interesting to see this side of you all in it morphing over to the health, the health equity, just making sure our people know how to take care of themselves. I didn't ever think I would be in fitness either. So it's kind of interesting just to see how this has morphed over the years. So I feel like it's been more than 4 years in the making. It's probably been something that's been inside of you for a while. And it's just finally came out. And now it's 4 years in. So it's really been neat to see you two grow and grow this and see it grow from year 1 to where we're at today. So what can people expect from the conference today? What we got going on?
Man, well, the first thing they can expect is the platform that we're on right now, the Community Resource Podcast.
Yes.
Now, this is new to My City, My Health. And the reason why we started, to do this, to do a podcast, one, we're both podcasters. So this is kind of like a natural thing.
Yes.
To be like, hey, what something that we should do that no other conference is doing, we should do a podcast for our vendors. Our vendors are a huge or our exhibitors or whatever you want to call them, they're a huge part of our conference. They are our sponsors. They are people that have a resource or a service that is important for our community to know that they are out there and what they do. People know about Iowa Total Care or Molina or whatever, but they don't know all of the services that are available to them. And it's hard to get that. It's hard to know when you're just going down a line of tables and just looking for a pen or some candy and then keeping it moving. Right. So we wanted to add some value to our vendors so they don't feel like, oh, we're just here at this table, same old, you know what I mean? But like really give them an opportunity to let people know, hey, not only are we, who we are, but these are also things that we do, and this is how we can provide a service for the community, and have that in a podcast form where people can go back to it, listen to it, and then we'll just create more content out of that, and it'll be something where we can just continue to spread awareness in a different way.
I think that is so unique and so neat. You have anything to add to that, Larry?
Well, I was going to say, our exhibitors, they are really a huge value add to our conference. A lot of our exhibitors, too, they provide services such as preventative, care types of services, and just ways to empower every single individual that comes through the conference. And so I'm just excited that we have an opportunity to give them a bit more shine. So shout out to them. Shout out to everyone that is on board with and those exhibitors that have had tables set up over these past 4 years or so. And we want to do more to amplify what they bring to the conference as well. So, but yeah, lots of amazing stuff that we're looking forward to for year 4. And every conference of ours has a little bit different flavor from the one previous. So, just so excited, and November 14th can't come quick enough.
Yeah, look, Paula's gonna be working that day.
Oh. Of course.
So we have.
I am
working, and we appreciate you for taking on this opportunity and being the very first host of the Community Resource Podcast, and being able to interview every single one of our vendors on that day. That is so. We'll see how it goes, but it couldn't be in better hands.
Yeah, I'm excited about it. I'm excited about how we navigate it. I'm excited about the conversations too, because some of these organizations I do know, but it's going to be great to hear more about what they offer and the services that they offer, and getting that information out to the community as well. But I just want to have a ton of fun with it, right? Just have some fun, no stress to it. Just give us the info and let's have some fun. And then to your point, Corey, that is stuff we can be pushing out all year, honestly, as well as doing little campaigns or what, especially like for Breast Cancer Awareness Month, or Autism Awareness. You never know what might come out of that can help elevate the knowledge and the education. Especially, I'm interested in the vendors that really have some, from a health perspective, some of those conditions that really impact our community, and getting that message out more and more, because as the times are right now, people are strained. They are going through. Life is out here lifing, and some people might neglect taking care of themselves just to survive, and we don't want that, right? We still need you to take care of yourself. So I think this is just like at the perfect timing, perfect opportunity to get more resources and information out for people, so they're aware of where to go. So if you all had to say, what is the one thing you're most excited about the conference? If you had to pick one thing, what are you most excited about?
I'll start, because I text this to Larry almost every year, and it may sound little, but it's the little things that make that make it so big. And I'll text Larry and I go, "Hey, bro, what you doing for that soundtrack this year, my guy? Like what we got going on?" Because that
Oh yeah.
really sets the tone. That sets the tone. We've had people come up to us. We did our very first Iowa City conference. This was a few years ago. I want to say it was right after the very first one. And we're just sitting there talking, and someone comes up to us and goes, "Hey, where can I get this playlist at?" Like it just adds so much to the conference. So for me, it's like, okay, well, what we doing? And that's what I get excited about.
You know what I got before you answer, Larry? I got to echo that because I remember last year I came in there and I started dancing with you. That soundtrack was fire. I was like, you were like, I just love my people. I was like, I just love this music. This music is getting it in the right tone. So I 100%
Yes.
agree with you on that, Corey. But what are you most excited about, Larry?
Every year, I walk away from My City, My Health, taking away just a wealth of knowledge about stuff that I didn't even know that I needed to know.
Mm.
um, so I mean, every year I learn something that I can pass along to a loved one. Um, I mean, honestly, one of my favorite panels that we had was well, it wasn't much of a panel. It was a maternity health discussion with Dr. Wanaki Carr and broadcaster Jody Long, and you know, my wife and I, you know, and our 5 kids. I think we're done with our, you know, childbearing stuff, but I just remember just learning a lot. You know, I had no idea some of the disproportionate or some of the disparities that were happening amongst women of color. As far as deliveries and just going through the process of childbearing and things like that, and so look, like I said, I'm just blown away every single year. I learn more and more. I share the information as best as I can that I take away from the conference, and you just never know what you're gonna get. You never know what kind of gems are gonna be bestowed upon you at MCMH. So
Yeah.
yeah, I'm excited about learning more, and of course it's just such a good time to meet new people, make connections, connect this faction with this faction, and connect this idea with this person, and stuff like that. So the networking and the introductions is always a good time as well.
Oh, 100%.
Oh yeah.
And before we go on to the next question, I want to add to what Larry said about the Black Maternal Health Panel, and I'm so proud of that panel. Not because, or like it wasn't. We had somebody that got sick, and someone
Mm.
could. So it was literally just like almost like a fireside chat with Dr. Wanaki Carr. So it still great. But what I'm most proud of about that conversation is how many conferences, I'll just say in the state of Iowa, had a Black maternal health focused conversation.
Yeah.
How many?
That's right.
You know what I mean? So like I'm proud to say that, hey, we listened to what our community was telling us that were important conversations to have, and we weren't afraid to have them at our event.
Yeah.
And as you talk
Yep.
about conversations, what can people expect this year as far as some of the themes and conversations topics?
Yeah. So same thing. So this year, we have an update. So I don't know if you remember last year, Dr. Nalo Johnson um, went up and kind of talked about the community health needs assessment, and there was links for people to provide their input and things like that. Well, this year, that community needs assessment update is now a panel. So we have all of the directors of public health in the counties. So Polk County, Dallas County, I think other counties are coming together along with Dr. Nalo Johnson from the Mid Iowa Health Foundation to give an update on the community health needs assessment and what they found and how can we apply those to our community. So that's kind of hit it. That's kind of starting us off is with that update.
Yeah.
And then we have our food insecurity panel, which is a huge one, especially now, November 1st, right? With, people not getting their food assistance or SNAP benefits. It's a timely conversation we'll be having about food insecurity with some great experts who are doing good work around food insecurity. And then we have our Save the Homies panel. So Save the Homies is a My City, My Health initiative where the first project underneath that umbrella of Save the Homies is our prostate cancer awareness initiative that we're currently doing. But this panel will mainly focus on Black men's health in general, not just prostate cancer. And we got some heavy hitters on this panel. And this is one, I'll make this plug right here. I need every Black man to join. And if you can't go to anything, be there at 1 o'clock to talk about your health with other men who are doing great work. So that's there. And then we're going to hit it off or shut it down with our Civic Engagement panel. We got some heavy hitters on there too, which for the longest time, I didn't even consider civic engagement a part of public health or health. Like what was the connection? I learned quickly what the connection was as I've grown within my health equity advocacy. I've learned a lot about why civic engagement is important. So we're going to be having that conversation with some great people as well.
Well, this all sounds like an amazing lineup, but unfortunately, I may not be able to see some of them because you're going to have me working all
out. Hey, no, we will have breaks in between that. So, we will figure out a plan. We'll make sure everybody will be able to.
But Paula, work is work. And so we just want to let you know now, we appreciate the sacrifice that you're making for the greater good. But we hopefully we will have created an environment for you to thrive in and just be the best you can be.
Oh yes,
so.
Y'all already know how I roll. I'm on the ebb and flow. I'm that ninja that's gonna come in and I'm gonna hear my little tidbits and whatnot. And I tell you, I love, for anyone who's not ever been to My City, My Health, the panels or the discussions are amazing. I was a panelist last year, and Larry, you were the moderator. That panel was fire to me. I felt like we worked so well together, and we just fed off of each other on that panel of leadership, and it was just amazing. And so the information that you get, just even if you're up there as an expert or a thought leader, you're still learning something new from everybody else who's up there, because it's just so amazing how different environments change what you might experience and what you go through. And so it's an amazing experience, not only for those who are participating or attending, but also for those who are sharing the knowledge, because we're all learning together, which I find so amazing, especially when you talk about health, right? Because it's a topic that we tend not to talk enough about. And so I have to ask this question: what made you all birth the idea of My City, My Health? Why
I love this story. Go ahead, Corey. I love this is a great story, because it's really it's more than the birth of the conference, but really it was the birth of a friendship that ultimately turned into a brotherhood. So I'll let Corey tell the story. But all of this stuff, just how we got together and how we worked through all this stuff, it all happened at the right time. Corey and I, we live in the same community, And so, we've it's just been a pleasure getting to know this guy and his family. Just earlier today, my son was assistant coaching his son's basketball team. And so. But no, it's a fantastic story. Corey, I'll let you tell it.
Yeah. So Paula, Larry and I had just met. Like we had been not just met, but we had been. It hadn't been long that we have realized. I had reached out to Larry because I was looking for more. I said I need more brothers in my life. Reached out to Larry on LinkedIn. Larry said, "I'm at the Row. Pull up, Smoky Row." And so one random day, I pull up to Smoky Row. We have this great conversation. Come to find out, we live in the same. I mean, like five. I could walk to his house if I wanted to. Our kids already knew each other. Our oldest kids, or my oldest kid, his second oldest. They already knew each other, and like it was like, oh, okay, cool, and we were rocking. We have the same, same kind of humor. The friendship kind of sparked. Just fast forward a little bit. I have a podcast called The Healthy Project. And at the time, my podcast was ranked in the top 200 in the U.S. medicine category. I was 182. I was, Paula, feeling myself. You couldn't, you couldn't tell me nothing.
Love it. There's nothing wrong with a little bit of confidence. Nothing wrong with it.
Yeah.
Nothing wrong with that.
Yeah. So we were on a Teams meeting for some. I don't know why we wanted to connect. We connected. We were on team. I was in my office, and I'm telling him how I got 182, and I feel like I should do more. I want to do something else. And Paul, he goes, Corey, the Healthy Project Conference, and I go, ooh. So at first he was like, I will be here to support you any way you need me to. He didn't want to be like. He was like, hey. If you need a shoulder to lean on, you want some questions answered, I'm here for that. I'm like, yeah, whatever, right? So fast forward, like that same week, I have a conversation with a patient I was seeing, and then she had a situation that we were able to fix. And in that moment, I came up, oh, health equity is a community effort. And we came up with the name My City, My Health. And I'm like, hey, what do you think about this? He's like, oh, dope. Love the name. Now, at the time, my idea for My City, My Health was one community panel. I was like, we're going to have almost like a city hall meeting. That was the initial idea. We'll have 4 or 5 experts from the community, and we'll just have a conversation, like a same thing, a moderator, couple panelists. And then Larry was like, hey, man, you should do something with mental health. I'm going to connect you with my homie, Brienne. She's dope. So I go, okay, we could do a mental health panel. Meet with Brienne. Brienne was dope. And I'm like, okay. So I'm like, hey, I have another friend, Kayla Bell. I think Kayla Bell Consalver. She'd be dope on this panel. I'll say, we have 2 panels. What if we do a prevention panel? So then they're like, we can't just have 2. And then it kind of grew to like, okay, we'll have 4 panels. So it grew to more than what the expectation was. And then we just started, we got together with the shout out to the homie. I can't talk about the success of that first conference without saying, Terrence Thames was a huge part of that success. Huge part. Connecting me with, telling me the game, how I need, a sponsor deck. Connecting me with sponsors who sponsor to this day. It's just played a huge role in that first conference. And then, we met once a week for months.
Yep.
Sometimes not talking about nothing, but we still met once a week.
But the thing is, though, the thing that I think is so cool is somewhere along the way, we realized that it was important to, take elements from other types of conferences that we've been to, but like we knew to really make this pop, we had to put our own touch on it, our own spin on it. We thought a little bit about what makes things not work out so much with other conferences, which is one of the reasons why we have the panels the way that we do. They meet one after the other with breaks in between, versus these panels going on at the same time and folks having to choose which where they wanted to get some game from, right? And so we making it accessible for everybody to participate in it. I'm really proud of us for coming up with that. And then even the idea, I don't know how this happened. I guess that's how God works, right? But just the idea to also turn this thing into a celebration. It doesn't have to be all stuffy. Yeah. We can start with some music, some up tempo music at 8:00 in the morning, during the registration and coffee time or whatever. Right. And the icebreakers, that we have around on different tables that force people to kind of break out of their comfort zone a little bit and interact with some of the strangers at their tables. So, a lot of people start the conference, as a stranger, and then they leave with friendships, partnerships, allyship. So yeah, we took all these ideas, and then we also kind of put our own unique twist things, and 4 years later, we're still here.
Yeah, and there's something to be said about when you leave with friendships and partnerships. I think after I got off that panel, well, number one, we had a line waiting for us to talk to us, right?
Yeah.
And then I had more connections on LinkedIn and Facebook after that panel of connections and talking to organizations about coming in and speaking or doing trainings or things of that nature. You just don't know what might come out of engaging. So if there's one thing I will tell people who are attending My City, My Health, for those who've purchased your tickets and are attending, I'm going to get to the ones who haven't yet, but for those who have, make sure you take every opportunity to meet somebody that you don't know. Take every opportunity to network and talk to people. You never know where those relationships are going to go. And I am still in contact with people that I have met last year from My City, My Health. And for the rest of y'all who don't have your tickets, I don't understand what you're waiting for. I mean, I don't get it. I don't understand. I mean,
it's right around the corner.
And it's not an expensive conference, y'all. I know some of y'all paying more money for some of these other conferences, because I be at them. I be at these conferences. I know you spending more money. This conference is a great conference to be at, to just learn about things that impact you. Why wouldn't you?
And can I talk about the price of our conference real quick?
You sure can.
Because I don't think people understand. I'll give you this. There was a conference, and I'm not going to say the name of the conference, that I really wanted to. This was years ago. It was $340 to attend this conference. Oh yeah, $340.
That's a lot,
right? That's a lot of money. We call ourselves. We want to be accessible for all. So this is not just for. I want people to understand. Yes, a lot of our attendees are healthcare professionals, public health professionals. Coming from nonprofit space, but also this is for the homie that works at the Dollar Tree but wants to learn more about their health. This is not. And I feel like there's a feeling if it's not super expensive, it's not worth it. That is wrong when it comes to My City, My Health, because it's that price for a reason. We're the $1.50 hot dog at Costco. That boy ain't ever gonna change, but it's still a hit. Like you can rely on that big dog. You know what I'm saying? Mm-hmm. So, I just want people to understand, like, hey, and again, $50 for some, depending on who you're talking to, $50 is a lot of money for some people. I get it, but when it comes to conferences, it'd be hard to find a conference at $50 with the amount of value that you're getting, and connections, as you pointed out, Paula, and the feel of community that you get at My City, My Health.
I 100% agree. I've been to so many
Absolutely.
conferences, and you have conferences that are 700, 1295,
Mm-hmm.
1595.
Yep.
Right? I mean, conferences go that
And that's
high.
if you remember.
That part. That part. Let's not talk if you're not a member, and let's not talk if you don't get that early bird or early bird price. Right? I'd have to agree. So, are there any parting words, anything that you would like anyone listening to this podcast today to think about, take with them, anything you want to impart, any words of wisdom at this point in time, something that hasn't been said yet?
Well, I am going to piggyback on something that has been said, and I just want to reiterate that, my city, my health, it is for everybody. I am that person that does not have the nonprofit or health background. I met Paula working in corporate America.
Right,
Um,
right.
but the things that the things that are being discussed and the things that we're being educated on are really things that impact or will impact every single person. We all know people that are aging. We all know people that have been or are disabled. We all know mothers. Just everybody falls in these groups, and really, My City, My Health. It is for that person that's thinking, gosh. There's what can I do? I know someone that is being affected or afflicted with XYZ. I see their struggle. I want to find ways to give back. I want to find ways to educate myself more on this. We're the conference for that, and on top of having access to those resources and learning, there's also just that I don't want to underestimate or undermine the fellowship piece of this as well. So you're in a space with like-minded folks. You're going to feel the support, the warmth, the love upon entry, and if you're looking for that kind of I guess tribe or group or collective, this is the place to be. This is the place to be. Get your tickets.
How about you, Corey? Any last minute parting words?
Man, I think Larry said
Mm-hmm.
everything that needed to be said. I don't really have much more to add to that other than, and I think I said this the first year. I think I've said it every year. Um, if you were to ask me, hey, what is it like? It's hard to explain. You just have to be there. You just have to feel what it's like. Like you can't explain it. It's just a different energy. And the only way to understand how it feels is to get your ticket and pull up on us November 14th.
And where are they pulling up at? What's the time and the location?
Curate Des Moines. It's on Court Avenue, in the East Village. Yeah.
323 East Court Street.
Yep, East Court. Pull up from 9 to 3. Our last panel will be over at 3. And yeah, it's a shorter day than last year. Last year was kind of a long one. Shorter day, but the same amount of impact.
Agreed. And I should correct that. It's 323 East Court Avenue. I didn't mean to say street. So somebody put that in the GPS and be like, well, we didn't get there because Paula gave us the wrong address.
Hey.
Yes.
Hey, listen.
Yes.
Where can you go? What other conference can you go to where the founder or the keynote wraps the conference up with some Nuck if you buck.
Nuck if you buck.
Right.
That part there. You know what made me so upset
if
about
you know,
that?
you know.
Nuck if you buck is one of our strolls for my sorority.
Yeah,
And I was
okay.
like, he's wrong for playing that. But that was so fire. That was so fire at the very end. Who knows what you're gonna come up with next time? But that was fire.
Hey, that was fire.
Yeah. Well, my pros.
Because you have to pull up to see what happens this year.
You do. That's the only way you're gonna know, because it's not the same watching the video. You have to be in the room when it happens.
Mm-hmm.
You have to be in that room. So with that, I hope you all got enough information. This is an amazing conference, My City, My Health. Again, November 14th. It will be at 323 East Court Avenue in Des Moines, 9 to 3 p.m. Get your tickets. Tickets are still on sale. $50 tickets, y'all. $50 tickets. And invite a friend. And if there's a friend who wants to go, gift a ticket. It's okay to gift tickets too. Mm-hmm. Gift a ticket and let's pack out this room and see what's going to go on. I'm excited about the Community Resource Podcast being a part of that. So I hope to see a lot of you out there making connections and networking. And with that, that's a wrap. Thank you all for joining.
Thank you, Paula. Peace, everybody.
Thank you. Appreciate you, Paula.